Pandemic's still going on.
That's what I heard.
And because the pandemic is still going on, our good friend Dr. Dennis Norem from Mercy Health has agreed to hang out with us again on another Monday, kicking this sort of thing around. Dr. Norem, good morning to you.
Good morning to you guys.
How's everything this morning?
Oh, it's good. 77 degrees doesn't sound too shabby.
No, that's overnight lows out in Tucson, isn't it?
I think so. I haven't checked, but I'm heading back there tomorrow.
Okay.
Oh, okay. Good luck. You're just missing the 80s out here.
Yeah, make sure you hydrate. You hydrate real well before going back.
Right.
Yeah, I'm sure it'll be so hot that I can't stand it. But
what a nice change.
Yes.
Lots of stuff to talk about as far as the pandemic, COVID, vaccines, and more goes. One being the Winnebago County Health Department announced over the weekend, following guidance from the FDA and CDC, they will resume the Johnson & Johnson vaccines to Illinoisans aged 18 or older. Quote, while the risk for thrombosis and thrombocytopenia is serious, it's also rare. Health experts across the country have reviewed the data and the benefits of the vaccine in preventing COVID-19, and the benefits outweigh the risks. I hope I didn't mispronounce those ailments.
no, very good. And I think it's a very appropriate recommendation. We're looking at a very small risk. I believe the total number of cases as they looked at this was 15 across the country. And we've given how many doses of J&J? I think we're up into the almost 10 million. So it's a very rare complication. It seems to be mostly in women under the age of 50. But I think they looked at the numbers and said 1 million vaccines will save 12 lives and will reduce hospitalizations of several hundred people and reduce the long-haul effects on many of those people that are hospitalized. So if you look at the risk-benefit, it's pretty clear that the benefits well outweigh that very small risk.
They say they're going to include a warning about the risk of side effect, especially for women under the age of 60.
Yes. And again, I think that's appropriate. They've documented that there is this very tiny risk, and it does seem to be limited to women under the age of 50, 60. And I think that's appropriate, but the J&J vaccine has, many advantages, being that it's one shot, it's much easier to store, it's less expensive, so it's very appropriate to get that vaccine back in people's arms.
So if you're a woman under 50, and I think we had a couple of those listening this morning, and you make your vaccine appointment, I don't think they tell you right away what you're going to get. If you show up and you don't like the vaccine brand that you're getting, how do you go about that? I mean, you just say no. Will they set you up with a type that you do want? How does that work?
Well, I think you can always say no. I mean, people have shown up, I think, rarely to vaccine locations and maybe change their mind. I mean, the patient always has the right to say no. That's their prerogative. But at this point, I don't believe you can request which vaccine you're getting. And I'd like to make the comment again that the important thing is to get everybody vaccinated as quickly as possible, regardless of which vaccine it is. We're not yet at the point that people can request a vaccine. Now, having said that, it's a little discouraging to hear that there are many vaccine sites across the country that are begging for patients. We're not close to being fully vaccinated, and I would encourage people to get vaccinated. I know this is going to add a little bit to that vaccine hesitancy that we've talked about, but this is what happens with all vaccines. You have to remember, even the vaccines that have been out for years, people still have very rare side effects. So please get yourself vaccinated.
I want to ask you, kind of touching on that, and maybe you address. I didn't get to talk to you guys last week. Maybe you addressed it last week. Is that the margin of error that we had? With the thrombosis, with the blood clots? I think we're with the 12 in a million, something like that, or maybe more. And they paused it for a second. Would that threshold be the same threshold for any other vaccine that came out? I mean, would they had paused a non-COVID vaccine that was causing this low of a percentage of problems?
Absolutely. I think at the time there were only 5 or 6 cases and 7 million shots. So they had to pause and look to see, are there other people out there that we didn't know about? And is there something else that we're not seeing here in terms of what it causes, in terms of side effects? So I think, again, it was a very appropriate pause to look at it and be clear that we understand how many people were affected and what the risks are, and then also look at that benefit side of the equation to be sure that where risk-benefit is well in the favor of benefit. And I think clearly this would have happened with any vaccine.
Okay. Yeah. But you want to, the minute the reports start coming in, that does give you pause, which, that's a whole lot better than, hey, you have a whole folder full of reports here that you just kind of ignored. That doesn't look good during depositions later on, I don't think.
No, absolutely. And at the beginning of vaccination years and years ago, there were some vaccines that caused some major problems, and it took a while to figure it out because it was much more difficult to get that data back to a central area like the CDC. Now we have, a much better and more efficient system of reporting these kind of things.
Speaking of the CDC, we have a kind of a plus minus going on between the CDC and Dr. Fauci. First, you got the CDC. We've got the 6-foot rule for social distancing and all that, but now it comes out saying that, that 6-foot rule, you might not really be the thing at all. It might not even help you at 60 feet, depending on the ventilation and airflow of the space. Keeping 6 feet of distance is no different than 60 feet. Researchers say overwhelming evidence indoor airborne transmission associated with micron scale aerosol droplets plays a dominant role in the spread of COVID, especially so-called super spreader events. So this 6-foot thing we've been working off of all of this time now, 6 feet's no different than 60 feet.
Well, I think it's one study. It kind of makes sense that it's the amount of time that you spend in an enclosed area is going to make a difference, and that does make sense. If you spend enough time in an enclosed area, it probably doesn't matter if you're 6 feet or 60 feet because those aerosols float around and they become concentrated enough that you start breathing those aerosols in, you're going to get exposed. Now, I think the 6-foot rule really made more sense in terms of the droplets, the heavy stuff, the spit that people would sneeze and cough, and when we talk, we kind of spit a little bit. That kind of stuff, probably 6 feet makes some sense because that doesn't travel 6 feet, but the aerosols can travel literally hundreds of feet. So it may be much more important how long you're in that body of air and you're exposed. And that does kind of make sense. Now, you got to remember that's one study, and as we've said all along, we're still in a learning curve. We still don't have everything completely figured out with COVID.
And that's the part, where I said we've got kind of the plus minus. You got Dr. Anthony Fauci now saying that the CDC will soon provide updated COVID-19 guidance on using face masks outdoors, basically saying it's common sense, kind of getting the idea that, well, he even said the risk for people engaging in outdoor activities is minuscule, especially those who are vaccinated. So we're talking about the idea that the outdoor mask requirements may go by the wayside.
I think so. I mean, you have to think that if you're vaccinated, especially and you're outdoors, that is an area of extremely low risk. I mean, outdoors you'd have to be sort of in intimate contact with somebody. I mean, you literally have to spit on them.
Like giving them CPR.
Or yeah, there's an example. CPR, somewhere, or maybe you find somebody that you really like and you want to make out with them. It's probably not a good idea. But anyway,
necking, is that what we call it?
Are you listening, Amy? All right. Doctor's orders.
Doctor's orders. Do not have intimate physical contact with anyone outdoors without having your mask on.
That's right. I'm going to draw a hard line with this.
Straight from the doctor.
Yep.
Straight from the doctor. All right. So, Doc, talk me out of this. We've seen people that we know are vaccinated. They're still lining up. They're still masking up in front of each other. That seems really stupid. Why bother get vaccinated if none of this is going to change right now? What do you say to me when I come to you with that?
you've got to get vaccinated. If you do nothing else, if you don't want to wear your mask, I mean, I feel that you should wear the mask, but we're not going to get out of this mess until enough people get vaccinated. I can't make that statement without qualification at all. I mean, we have to get people vaccinated. There's no other way out of this. If we want to open up this country, if we want to get to the point where we don't have to wear masks, the only way that's going to work is we get people vaccinated. And I see on the news, they interview people who say, well, I got vaccinated, but I don't want to get my kids vaccinated because I want to wait until I think the vaccine's safer. And I think that's just ludicrous. We've vaccinated, 90 million people, 100 million people. What are we waiting for? And everybody complains about the mask and the rules and the social distancing. If we get enough people vaccinated, we can get beyond all those things. So please get vaccinated.
I've been out of the loop for a bit and haven't been paying attention to the news, but one word I haven't heard in a minute, which sounds like we should be hearing it a lot, is herd immunity. Do we still have the same percentage brackets to get to herd immunity?
Yes, we do. We're still probably going to need to get to that 75, 80, 85%. However, having said that, again, I look at what Israel's done. I think they're close to 60% fully vaccinated, and their rates of transmission and new cases are extremely low. So if we can even get, into that 50, 60 range, we'll see, I think, the number of new cases drop dramatically. And we can look across the world and look at places like India that are just getting ravaged because they've had very low percentage of their population vaccinated, and they're just being overwhelmed. So that is a big concern. We still have, some pockets in this country like Michigan and a couple other states where the rates are still pretty high and hospitalization numbers are still up there and putting some stress on the healthcare system. So we've just got to push ahead.
When you mentioned India, one of the worst outbreaks there, recorded another record in new cases with 352,000 and change over the last day, 2,800 deaths. This one jumps out. BBC reported the UK shipped its first consignment aid on Sunday that included 495 oxygen concentrators. Correspondent from the network who covers India posted a video on Twitter that she said showed an oxygen tanker with an armed police escort. One of the officers saying to her, this stuff is more precious than gold right now.
Yeah, they're buying and selling oxygen on the black market. The sad thing is you see pictures of hospitals with signs on the door, we're not accepting any more patients, we have no oxygen. And people are literally dying in the street in front of the hospitals. Obviously, their healthcare system is a little different than ours, but it illustrates how bad this pandemic can be in terms of these numbers. And you look at that 350,000 in a country of 1.2 billion, 1.3 billion. You'd say, well, that's not so bad, but you have to think that they're only counting the cases they know. There's probably, who knows, double that out there that nobody really knows. People are just dying with no idea that they're COVID positive because they've never been tested.
Yeah, because they're out in rural areas that the reach of modern medicine, it's just not there.
Yeah, and you have these large slums where, again, even though they're in an urban area, there's no health care. There's nobody to test them. They have cities, 10 million, 15, 20, 25 million, huge areas where people are dying and really have no access to any kind of health care.
What's your thought of the European Union over the weekend? European Union Commission President Ursula von der Leyen says that the European Union will let vaccinated Americans visit this summer.
I think that is encouraging. I think that's very, very reasonable. I think we're looking again at many types of situations where we're going to have travel, college, whatever. People are going to be required to have vaccines. I think if you talk to anybody who's flying to Hawaii, for instance, you absolutely have to show either your negative or proof of vaccination. I see several colleges, at least 30 universities, have already listed the fact that they're going to require their students to be vaccinated. I think clearly for international travel, you're going to have to prove vaccination. I think that's just common sense. And again, if people want to get out and do those kind of things, you're going to have to get vaccinated.
Well, at least it's heartening to hear that, the idea is there and, vaccinations keep going on. Then, people who've always wanted to visit Europe, it looks like you might not have to wait nearly as long as we thought initially you were going to have to. Dr. Norem, that runs us out of time, and we, as always, appreciate your time and expertise on this one. Unless something miraculous happens and they put an end to this over the next week, we'll look forward to talking to you next Monday.
I suspect we will be talking.